Welcome to the podcast where we're going to work some selected practice problems involving some calculations involving measures of potency. So, up to this point, we've done some previous chapters where we've done very similar calculations, but those were when the drug dose was based off of a weight or maybe body surface area. Here, we're going to do some calculations where the amount of drug isn't dosed off of weight but on potency. And that's not the common example. Most drugs, in fact, most drug doses are expressed in terms of their weight. For example, a normal dose of acetaminophen is expressed as 650 milligrams per dose, or that maybe a total daily dose of acetaminophen is between 3 to 4 grams per day. Okay, most drugs are like that, but not all. There are some very important exceptions. I think maybe the one that most people are more common with would be something like insulin. Insulin is not dosed on weight, but on units. So insulin is like other drugs where there are some exceptions where the dosing of these drugs are not expressed off of weight, but rather in their units of activity or potency. And a pharmacist must be able to perform these calculations using these drugs, whether they're ordered, for inpatients or on prescriptions, regardless of where the drugs are being used. You must be able to carefully and accurately calculate the doses for these different types of drugs. So, with that as enough introduction, let's go ahead and get started with the first question. All right. The first question involves hepatitis B immune globulin, and shown here kind of in that vial. And before we get into the question, a little bit of background to make these kind of questions a little more interesting is why would we give somebody hepatitis B immune globulin? And that is actually often abbreviated HBIG or HBIG, and it stands for hepatitis B immune globulin, and it's actually a solution of immune globulin that's already been prepared and actually primed against the hepatitis B surface antigen. Essentially, it's an antibody against this surface antigen. So by administering somebody HBIG, you are inducing passive immunity. They have immunity against that virus. And why would you ever do that? Well, you would give somebody these antibodies if they've been exposed to the virus and they weren't already vaccinated. So patients who are exposed to hepatitis B virus either through exposure to blood or through sexual contact or household exposure, or even sometimes infants who are born to mothers who are hepatitis B surface antigen positive. These individuals, if they're not immune, if they've not been currently vaccinated, then instead of having to delay and risk their becoming infected with this virus, we can give them the antibodies a vaccinated person would already have. So we'll go ahead and just give them the immunoglobulins that protect against hepatitis B. Now, we'll be covering in your other lab course about how to give vaccines, and hepatitis B vaccine is an important vaccine to help prevent people from being exposed to this virus by having them generate their own antibodies. But in this case, we're not talking about a vaccine, we're talking about the actual antibodies themselves. So, we want to protect somebody against the potential exposure to hepatitis B virus. So now if we read the question, it says this, excuse me, hepatitis B immune globulin vial contains 312 international units per milliliter. If the dose is 0.06 milliliters per kilogram for certain at-risk persons, calculate the dose both in milliliters and in units for a 132-pound person. All right, we can do this. But as with any question, let's restart by rewriting and organizing the information given to us in the question. So what I would start off with is by saying, okay, what do I know about the patient? What I know about the patient is that the patient weighs 132 pounds. That's it. That's all I need to know. What do I know about the drug? Two things. I know that the dose that we want to provide of the drug is expressed as 0.06 milliliters per kilogram. And then lastly, that the concentration of the drug in the vial is equivalent to 312 international units per milliliter. All right. Well, with that information, we can answer this question. So, and again, we're going to want to do two parts. The one, calculate how many milliliters this person needs, and in that volume, how many units will they receive. Well, let's just do this. I'll start by showing you my equation, but the first step is to start with the patient's weight. And we're going to convert their weight in pounds, the 132 pounds, into their weight in kilograms. And we do that by multiplying by the fact that in every 1 kilogram there are 2.2 pounds. So we divide 2.2 into 132 and we'll express their weight in kilograms. The next step is to take that weight and multiply it by the dose. And we know the dose was told to us as 0.06 milliliters per kilogram. So if we multiply in this way, kilograms will cancel, and our final answer will have units of milliliters. So if you do all of that math, we'll see that the volume of this H big that we need to provide this patient from the vial is 3.6 milliliters. But the question also wants us to express how many units that would be equivalent to. So to go on, we would then take the volume we're going to administer, the 3.6 milliliters, and multiply that by the concentration in the vial. And that vial was 312 international units per milliliter. So now if we multiply, milliliters will cancel, and our final answer will be in units, international units. So the final answer for units would be 1,123.2 international units. That's the dose in units that will be provided to the patient who receives 3.6 milliliters of the drug from that vial. And those are the answers to that first question. All right, let's start with our second question. Now, this question involves a vial of calcitonin, which has the brand name of miacalcin. A little bit of background about calcitonin is it's interesting. It's actually a polypeptide hormone product that is produced naturally by the parafollicular cells of the thyroid glands in humans. Now, this hormone that's produced is intended to bind to receptors on osteoclasts and actually inhibit or stop bone reabsorption of calcium from the bones and therefore decrease serum calcium levels. Okay, if we don't reabsorb or leach calcium from the bones, then the serum calcium levels in the blood would decrease. What's interesting about calcitonin is they found out that the calcitonin from salmon, yes, the actual fish, is in fact 40 to 50 times more potent and has a longer duration when used therapeutically than human calcitonin. And this is because its structure differs from human calcitonin by 13 amino acid residues. Don't ask me who figured that out. I'm sure they're rich by now. It was an interesting finding. What it comes down to, though, is that the commercial preparations, like you can see the vial in this picture, are actually salmon calcitonin prepared synthetically using recombinant DNA methods. So we don't extract it from the fish, but we have the genetic code from the salmon, put that into yeast cells, and those yeast cells go crazy and produce a bunch of this hormone that we can then bottle and use to treat diseases. What would we use calcitonin to treat? Well, there are diseases like Paget's disease of the bone, or sometimes we'll treat postmenopausal osteoporosis that can occur. So that would be why we would use this drug. Let's get back to the question. The question says that calcitonin is available as an injection at a concentration of 200 international units per milliliter. Now, adult doses of up to 32 units per kilogram have been shown to produce no adverse effects. On this basis, if a 120-pound patient were to receive a 0.75 milliliter dose, would you expect any adverse effects to occur with that dose? All right. That's, one of these questions that are kind of worded, I think, in a kind of a funny way, so let's rewrite it. What do we know? We know in this question that we have a patient who weighs 120 pounds. What do we know about the drug? Three things. We know that the maximum safe dose of using this drug would be 32 international units, or IU, per kilogram. We know the dose we want to administer to our patient is 0.75 milliliters. And we know that the concentration of calcitonin in the vial is 200 international units per milliliter. So from all of that, can we answer the question that would we expect adverse effects to occur when we give a patient who weighs 120 pounds a dose of 0.75 milliliters? So let's answer that question. So again, I re-showed you the information that I've rewritten here, and where are we going to start? Let's start with the patient's weight. So we're going to start with actually converting their weight in pounds, so 120 pounds. Let's convert that to kilograms by multiplying it by 1 kilogram over 2.2 pounds, so that pounds cancel. And we'll see that our patient weighs a total of 54.5 kilograms. That's just their weight in kilograms. Now, the next step is to actually figure out what would the maximum number of units be that would be safe for this patient. So we're going to take this patient's weight of 54.5 kilograms and multiply it by the safe dose that we know, which was 32 international units per kilogram. So if we multiply and kilograms cancel, we can see that the maximum safe dose for a patient who weighs 120 pounds would be 1,744 international units. Okay? That's not the answer, but now we know the maximum dose. We have to give our patient less than those units. If we give them less than 1,744, they probably won't have any side effects. But if we give them more than that number of units, then we would expect them to have some potentially adverse reactions. So let's now calculate how many units we're going to actually be giving our patient. So to start with, I'll show you my formula here. And remember, the question said we're going to administer 0.75 milliliters. So if we take that volume times its concentration, which we said on the vial was 200 international units per milliliter, we'll see that milliliters cancel, and we'll get a final answer of 150 international units. And this represents the dose our patient would receive when they get 0.75 milliliters. So now we can answer the question. And the answer to the question was, would adverse effects be anticipated? And the answer is no, because the patient dose of 150 international units is actually much less than the maximum safe dose, which we calculated to be 1744 international units. So we're well below that amount, so at this dose we wouldn't expect any additional adverse effects. And that's the answer to that question. All right. Moving on to question number 3, and it involves the drug alteplase. And alteplase is a thrombolytic agent, which basically means it dissolves clots, blood clots, or is a clot buster. Clinically, why would you use that? Well, you use this sort of drug to break down blood clots that can occur in places like the lungs, and that's called pulmonary thromboembolism. Or you could get a blood clot in the brain, which causes acute ischemic stroke, or even in the coronary vessels, or the vessels around the supplying blood to the heart. That's called acute coronary arterial thromboembolism. Those are all just fancy names for essentially a blood clot that could occur in any one of those organs, the lungs, the brain, or the heart. And clearly that would be a bad thing because it would block the supply of blood to those important organs. Now, the drug, alteplase, is a recombinant form of actually the hormone human tissue plasminogen activator. Okay? So, and this is actually the drug, alteplase in the vial, is produced genetically using the genetic code in being inserted into a modified Chinese hamster ovary cells. So instead of yeast, we use these Chinese hamster ovary cells. They get this genetic information and they produce a bunch of this basically protein. This alteplase is then the form that we can use therapeutically to break up these blood clots. All right, so that's what we're doing. Now we can look at the question, and it says, obviously we need it for one of these reasons, but we have a vial for preparation that contains 100 milliliters of injection. Okay, so the volume is 100 milliliters. In that volume, it's going to contain the drug alteplase, and it's going to have a total of 100 milligrams of drug, which is equivalent to 58 million international units. And we're going to use this drug to administer it via an intravenous infusion. And the question asks us to calculate a couple of things. First, we want to know the number of units administered to a 176-pound patient at a dose of 0.9 milligrams per kilogram, and the milliliters, or the volume of an injection to use to provide that dose. So, to rewrite this information, what do we know? We know that we have a patient who weighs 176 pounds. What do we know about the drug? A couple of things. We know that the dose to give this patient is 0.9 milligrams per kilogram. We also know the concentration of drug in the vial, but this is where it could be a little bit confusing because this one vial essentially has two concentrations. Even though it's the same concentration, you can express it as having a total of 58 million international units per, and this is important, the 100 milliliters. Remember, there's 100 milliliters in the vial, and it has a total, therefore, volume of 100 mils and a total number of units of 58 million international units. It also has, therefore, we know the concentration of 100 milligrams in that 100 milliliters. So we could express the concentration in either units or in weight because we have that information. And obviously we know, therefore, if you look at the volumes being the same, that 100 milligrams is equivalent to 58 million international units. So using both sets of that information, we're going to need that to be able to answer this question. So let's answer this question. Where are we going to start? Well, again, I'll show you the whole equation here to begin with, but we're going to start with the patient's weight. Again, we know that our patient weighs 176 pounds, and we're going to need to convert that to kilograms. So we'll take 176 and divide by 2.2 so that we convert pounds, cancel, and get kilograms. That'll give us the patient's weight in kilograms. The next step is to take their weight and using the dosing schedule, convert that to the amount of drug that we need. So we know the dose is 0.9 milligrams per kilogram. So if we multiply by that, you can see that the units of kilogram cancel and we will be in milligrams. Easy enough. Now, what the question wants to know is how many units is that going to be equivalent to? So what we have to do is use the concentrations. As I said before, what we know that we have in our drug vial is that we have 58 million international units. And we know that 58 million units is the same as having 100 milligrams. So if I set it up and multiply it by the number of units over the number of milligrams, then my milligrams units will cancel. And if I cross multiply all the way across, I will have a number that is a value in units. So if you do that math all the way across, you'll see that this 176-pound person converted to kilograms times 0.9 times the concentration would give us a total dose of 41,760,000 international units. That's how many units this patient will receive. So that's the answer to part A. Part B will want us to calculate the volume for that. So to do that, I'll show you my formula here, but it will start with the dose we just calculated. We will be administering to this person 41,760,000 international units. The volume will convert to by using the concentration, expressed by the fact that we know that there is in 100 milliliters, there is actually 58 million international units. So that comes from the vial concentration. So if we take our dose of 41,760,000 international units, multiply it by 100 milliliters, over 58 million international units, which comes from the concentration, we can see that our final answer is 72 milliliters. So this patient needs to receive 41,760,000 international units, and they will receive that if we take 72 milliliters out of that initial vial that contained 100 milliliters. So that's the dose that they need, and that's the answer to this question. All right. Fourth question here involves insulin, and you'll learn a lot about insulin in pharmacy school. It's used both in inpatient, hospital, critical care settings, as well as outpatient, kind of in the day-to-day long-term management of patients with diabetes. In this question, before we read to it, it is kind of a hospital or acute care setting. So why would you need to put insulin into an IV bottle to give and infuse continuously? Typically that happens a lot with kind of the emergency called diabetic ketoacidosis, often abbreviated DKA. And this is a major life-threatening complication that can occur in some diabetic patients, most often in type 1 diabetics or insulin-dependent diabetics, but can also happen in older type 2 diabetics that have kind of more the adult onset. Either way, DKA is a complex condition where the metabolic state is altered due to and causes a couple of different things. It causes very high blood sugar levels called hyperglycemia. It also causes what they call ketoacidosis, which is essentially just a lowering of the blood pH, and also has these ketone bodies form in the urine. So lots of things that have to be fixed in this situation. It is such a serious condition, it is usually managed in an intensive care unit, and the stay is at least 1 to 2 days in the ICU. In that time, part of what they do is to lower the blood glucose, get it back down to normal. And they do that by continuously infusing insulin. Okay. Now, it's usually at a faster rate at first, and as the DKA improves, then they'll reduce the amount of insulin that has to be infused. But in this question, you can imagine we're at the very beginning of a patient with DKA being administered into the ICU who needs some insulin via an IV infusion. So that's where we're at. Let's kind of read the question. It says, a physician's hospital medication order calls for 0.5 milliliters of a U500 insulin injection, and I show you that picture of that bottle here, to be placed into a 500 milliliter bottle of a 5% dextrose and water injection for infusion into a patient. Okay, so just so you can see here, what we're going to do is we're going to take 0.5 mils out of that insulin vial, and we're going to inject that into a bottle, as you can see on the far right, that already has 500 milliliters of dextrose 5% solution. Okay, then what the question goes on to say is that if the rate of infusion was set to run for 8 hours, okay, so that 500 ml bottle will run for 8 hours, the question actually wants to know how many units of insulin did the patient receive in the first 90 minutes of this infusion. So, looking at that question, wow, there's a lot of information there. This is a very hard question until you simply break down the information that you know. So what we know is, as far as the insulin or the drug information, we're going to use 0.5 mils out of the vial, and that vial has a concentration of 500 units per mil. And hopefully you can see on the vial, that's essentially what U500 stands for. It stands for 500 units per milliliter. Okay, that's what we know about the insulin. The solution we're going to be injecting that insulin into has a total volume of 500 milliliters. Okay. And then lastly, that bottle, that 500 mils that contains 0.5 mils of insulin, all of that is going to be administered over a total time of 8 hours. So that's what we know, the information that we have. With that, we can answer this question. So the first step in this question is, and again, relates to what it's asking for. It wants to know how many units the patient will receive of insulin in the first 90 minutes. So I show you my entire formula here, but let's remember we're going to start with the fact that the patient is going to receive this infusion. We want to know how much insulin within the first 90 minutes. So let's start with 90 minutes. And that comes from the question. The first step actually is to convert that value, 90 minutes, into hours, because the rest of what we need to know is how many hours this is going to last. So we are going to take our 90 minutes and times the fact that in 1 hour there are 60 minutes. By doing this, our units of minutes cancel and we're in hours. So the first step is simply to convert 90 minutes essentially into 1.5 hours. Why do we need it in hours? Because the next step is to convert the time, the hours, into a volume. How much solution will have been administered to the patient in that amount of time? So we're going to multiply it by what we know is the administration rate, and that's 500 milliliters of solution over 8 hours. Okay, so 500 mils over 8 hours, hours will cancel, and what we will know at this point is how many milliliters of solution will have been administered in this amount of time. Okay. Now, the next step is very important. We don't want to know how many mils of solution the patient gets. We want to know how much insulin. So we need to multiply this by the fact that we know that there is 0.5 milliliters of insulin in the 500 milliliters of solution. Okay? By multiplying by this, you can see the units of milliliters of solution cancel, and our answer now is in the milliliters of insulin. At this point, we've converted time to hours, hours into the volume of solution administered in that amount of time, and now we've converted from milliliters of solution to the milliliters of insulin in that amount of time. Okay, that means our last step is to convert the volume of insulin into the number of units. And we can do that because remember, we know that the concentration was 500 units for every milliliter of that insulin. So if we multiply by 500 units over 1 milliliter, then we see milliliters of insulin cancel, and we're in units of insulin. And our final answer then is 46.88 units. That would be the number of units that a patient has received by the time they have infused this solution for 90 minutes. All right, the last question, and I love this question because I think it's probably the hardest question, but it's not because of the units or the potency. Hopefully up to this point you realize dealing with these sort of dosing questions and equations, whether it's weight in milligrams or units, it's not different. The way you approach these problems and setting up so that your units cancel are identical. So this question, in that sense, you'll see is no different than the rest. But what I like about this question is it brings back, to answer the question, you need to be able to perform an aliquot. And I know you've covered aliquots already up to this point in this course. And it's a good example. In this prescription that we're going to try to compound here is a good example of why you would need to do an aliquot. In this case, we're going to be aliquoting a drug whose dose is expressed in units. And so let's read the prescription and read and interpret it. So it calls for a penicillin G potassium nose drop. That's the product we're trying to compound. Why would we want to do that? Well, understand penicillin G potassium is essentially an antibiotic, and nasal antibiotics can be sprayed directly into the nasal passages, and these treatments often help decrease the development of certain sinus diseases in patients who are prone to recurrent sinusitis. So not common, but there are some patients who benefit from spraying occasionally these antibiotics into the nose to help minimize their chance of developing another case of sinusitis. Okay, with that said, what are we trying to make? Well, we want penicillin G as the antibiotic, and we want the final product to have a concentration of 5,000 units per milliliter. Okay? Now, in the actual drop itself, we're going to add and use sterile or isotonic sodium chloride solution and have a final volume of 15 milliliters. And up above, going back to the question, now that we've seen the prescription, the question says, using soluble penicillin tablets, each containing 200,000 units per tablet, how would you compound this prescription? So let's rewrite the information that we need to know to answer this question. What do we know? The product we want to make is penicillin G nose drops that has a concentration of 5,000 units per mil and a total volume of 15 milliliters. Boom. That's what we're going to make. To make that, what do we know about the drug? This is important. We know we only have available tablets, and these tablets have 200,000 units per tablet. All right? The other thing that's important to interpret from this question is this idea of solubility. The drugs, penicillin G, is freely soluble in any reasonable amount of water. So what we're going to do here is we're going to take some of these tablets and crush them up and dissolve them in water. And they're so readily soluble in water that we can choose any reasonable amount. So we're going to go from a tablet, we're going to dissolve that tablet in water, and then use a certain amount of that water that contains a certain amount of that penicillin to be able to formulate these nose drops. So with that, let's figure out how to do it. All right, so here's all that information rewritten here. The first step, what is the first thing we're going to do? We need to know that if I'm going to make a 15 milliliters of nose spray total, and it has to have 5,000 units per mil, what is the total number of units I need to compound? So this just reminds you, where does this come from? We want a total volume of 15 mils. So if I multiply that by the desired concentration of 5,000 units per milliliter, we get a total number of units to use in our product has to have 75,000 units. 75,000 units would make 15 milliliters have 5,000 units per milliliter. All right, so our target to get from our tablets are 75,000 units. There's a problem there, because what did we say the tablets had? We said one tablet, just one tablet by itself, has 200,000 units. So I can't use less than one tablet, so I'm not going to be able to start with less than 200,000 units. But I don't want 200,000 units. I only want 75,000 units. How am I going to deal with that? Oh, I remember aliquots. I can solve this problem using an aliquot. So the first thing I need to do, though, is understand when I get 200,000, but I only want 75,000, how much more am I getting? How many more times the drug am I getting? So to do this question, what I'm leading up to is just let's solve this. Let's say what I will be getting from my tablet is 200,000 units. And you can see where that comes from up above. What I'm going to put down below is the amount that I actually want. I only want 75,000 units. So understand, 200,000 divided by 75,000 means I will be getting or receiving 2.667 times the amount of drug that I want. I only want 75,000, I'm getting 200,000, which means I'm getting 2.667 times. And that is essentially 2 2/3 more drug than I actually want. Okay, so I'm going to have to deal with that. But now I know the relationship of how much more I'm getting than I actually want. I'm getting 2.667 times the amount that I actually want. Now, how am I going to deal with it? The idea of an aliquot. And with this aliquot, what's very important to understand to be able to set this up is keep in mind that this drug is freely soluble. So I can dissolve that one tablet with the 200,000 units in any volume I want. Okay, any volume. Okay, but whatever volume that is, I need to remember that volume will have 2.667 times too much drug. So I don't want that full volume. What I want is a take back only a fraction of that volume, and that fraction is the volume that will only have 75,000 units. So keep in mind what I'm going to do here. We need to find two volumes. I need to find one volume that I initially dissolve my tablet in, and then I need a smaller volume. This smaller volume, though, has to be multiplied, whatever volume I choose. If I multiply that by 2.667, that has to equal the volume I dissolved my initial 200,000 units in. Okay, so I've got to find one volume, a small volume, that when I multiply it by 2.667 equals the larger volume. Small volume, large volume. I have no idea what volumes to use. Let's just experiment. Remain calm. Let's just try a couple of numbers and see if we can come up with something that works. So my first guess would be 2 mils, right? It's a small volume, but the drug's freely soluble. So if I start with 2 mils, if that's the volume that I'm going to want to measure my final 75,000 units in, then what is 2.667 times that volume? What would the larger volume be? 2 mils is the small volume. 2 mils times 2.667 gives me 5.34 mils. Yuck, that's not a very round number. I could do it. It would work. As we go forward here, these numbers could work, but they're not convenient numbers to use. So let's just not stop at the first thing we try. Let's try it again. So what if we did 3 mils? So if I took my smaller volume to be the 3 mils, then what is 2.667 times 3 mils? You know what? That turns out to be exactly 8 milliliters. Oh, that's a very nice, convenient number. So truly, if I take 3 mils and multiply by 2.667, that's exactly 8 mils. That's the combination that I need. My larger volume will be 8 mils, and if I pull back out 3 mils, then I'll have exactly the relationship that I want. And let's prove that by looking at the procedure. So I know this is a little confusing, so let me go through the procedure, and then we'll check the procedure by doing the math to show that it works. So the first step in the procedure would be to dissolve one tablet that contains 200,000 units in 8 mils of water. And so that's where that is here in this formula. We said one tablet has 200,000 units, and we're going to put that in our larger volume, which we said was 8 milliliters. All right, that's the proportion of 200,000 over 8 milliliters. So we're going to do that. But we don't want all 8 milliliters. That has too much drug. We said that we're going to take only 3 milliliters out of that 8 mils. So that's why we have 3 milliliters times that concentration. What do we do with the other 5 mils? Well, just throw it away. We don't want it. It has too much drug. So it's only the 3 milliliters out of that initial 8 that I want. Because if I take 3 milliliters times 200,000 units over the 8 milliliters, that gives me the 75,000 units that I want. Remember up above there, that's the total I need for compounding my prescription. So 3 mils out of that 8 provides the amount of drug that I want exactly. But we're not done. The next step in the procedure says to take that amount, the 75,000 units, remember, which we said is contained in 3 mils. So to that 3 mils, we need to add an additional 12 mils of essentially water, or the sodium chloride. So we take the 3 mils, we add the additional sodium chloride. 3 mils plus 12 mils is 15 mils. That equals total of 15 mils that we're going to divide into the 75,000. So if we take 75,000 units and divide it by 15 mils total, that's where we get the 5,000 units per mil. And that's what we were trying to compound with the initial prescription. Okay, so to summarize, we take one tablet that contains 200,000 units, dissolve it in 8 mils of water. We then only pull back 3 mils of that fluid, That 3 mils would contain the 75,000 units that I want. Discard the rest of that. I then add an additional 12 mils of that isotonic sodium chloride solution, mix that together, and that gives me my 75,000 units in a total of 15 mils, which gives me 5,000 units per mil and gives me the amount of drug that I need. So I know that was a kind of a more difficult equation, and it was almost more of a review of aliquots, but we've essentially performed an aliquot with a drug that expresses its units of its activity in units of potency rather than weight to show that it works very similar to any drug that you would have done if it had been based off of weight. So hopefully you found this helpful and a good review.